Good afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness at the Knox County Health Department. Thank you for joining us for our very first virtual media briefing. It is important to us to switch to a virtual model to protect the health and safety of our media colleagues as well as our staff. Our sign language interpreter is also in another room to ensure that we are adhering to social distancing practices that we are encouraging. We appreciate you working with us as we navigate this new model. We want to begin today with a moment of gratitude again. Over the past few weeks, we've received calls and emails from people in the community who just want to help. Whether it's a donation of one's skills, time, or resources, we are grateful for this community and its volunteer spirit. Questions about volunteering can be directed to Volunteer East Tennessee. In regards to the Governor Lee's executive order that begins today, we support this order and are thankful for the commitment this governor is providing to keep the people of Tennessee safe and healthy. As allowed under the order, we will continue to provide more stringent local guidance to safeguard our community. A good example of this is the closure of playgrounds. This is not required in the governor's order at this time. However, our local governments have made a decision to close these playgrounds to protect our community and limit exposures. We also still strongly encourage that people avoid any type of mass gatherings of 10 or more people. Moving into the local situation, as of this morning, we have 63 confirmed cases of COVID-19 in Knox County. 24 of those have recovered. 11 have been hospitalized at some point in their illness. We have not had any more deaths due to COVID-19 in Knox County at this time. We continue to urge people to use social distancing when they are out in public. When you're going to the grocery store, enjoying our parks and greenways, waiting for a food truck. Please make sure you are keeping at least 6 feet between you and the next person. It's also very important to note that social distancing is really just physical distancing. We encourage everyone in Knox County to connect with each other during this time by phone, letter, FaceTime, whichever other ways that you can do so. Social distancing does not and should not mean relational distancing and emotional distancing. We are all in this together, and it will take all of us to reduce the spread of illness and get back to normal. At this time, we'll open it up for questions.
Okay, so the first question we have is from the Knoxville News Sentinel. This question reads, yesterday, Dr. B said the number of ventilators and hospital beds was held, quote, very closely and tightly. Other areas, like the state of Indiana, have begun releasing this information. Why is this tightly held, and who has access to this information?
That's a great question. I think that that's a really nuanced question. With the details of that are very hard to explain how they work. So the information that has been reported from the Tennessee Department of Health on what's available is from our joint annual report from 2018 of what's available. But hospitals have a lot of systems in place and levers that they can pull to expand capacity in a lot of different ways for different bed types and medical needs that are available. And so it's not it's a snapshot in time number that's available that we're gathering on a daily basis. It's not the real-time data that's available. And really, we want the healthcare systems to focus on caring for the individuals that need care instead of providing that real-time snapshot data that really could change at any minute based on other plans that they implement in their facilities to meet the need at the time. I think the really important thing here to stress to the public is that our hospitals and healthcare partners continue to plan together, and they work together as a team, so they're in lockstep as they are implementing measures to be able to handle increased patients that we may have during this pandemic. And I think that's really important for people to have that information.
Okay. The next question is from WATE. They say, talk about the new policies for food trucks. Why were they changed? How are these changes going to help?
So really what we're trying to focus on overall in general is staying away from people, keeping those social distancing measures so that people are staying at least 6 feet away from each other, that they are, staying away from those items when they're sick. But we really don't want people congregating while they're waiting for foods at food truck or walking up to food places to pick up food. We really, really want people to stay apart. And that's where I think those guidances are coming from and what makes it so important. It really gets back to the basic message of social distancing, that we want to have people staying apart so we're not intermingling and spreading this infection.
The next question is from WBIR. They say, we've gotten some questions about WIC benefits and how others in the community can help. First, do WIC benefits operate as normal? Do they come in around the first of the month? And second, should people in our community be mindful of what products they buy in coming days to help those who use WIC/SNAP benefits?
So the WIC benefits are being being managed by phone at this time with our WIC staff. There's not an interruption in those services at this time. And so we encourage people to call into our WIC department to get those needs met at this point. What's the second part of that?
The second part is, should people be mindful in our community of what products they're buying in the coming days to help those who use WIC?
I think overall, people should be mindful of the amount of products that they're buying. You need to be buying the normal amount of supplies and food that you're buying for your family every day, because there are the resources there that are available, and we don't want to buy too much and stockpile so people can't get what's needed. So I think that's a general message across the board.
Okay. The next question is from the Compass. Under Governor Lee's order, can Dr. Buchanan institute more stringent restrictions? Likewise, can she lift any restrictions that are part of the governor's order?
So the governor's order does allow for the local governments to enact more stringent restrictions. And that was a good example of the playgrounds that I gave previously. And so we do have the authority to do that. And we'll do that in concert with our local elected officials when those decisions are made. So we can do that.
The next question is from the Sentinel. How many masks are on hand at local hospitals, and why has the University of Tennessee Medical Center already, even this early, started reusing masks?
So I don't have a good firm number of how many masks are on hand. That's a very fluid number. But there are strategies that are recommended to start conserving your mask and your personal protective equipment now so that they last longer and we have more available throughout this process when they're needed.
Following up on that question from Channel 6, they have asked, what are nurses, doctors, healthcare professionals being told to do about masks? Can they use masks that people are making at home?
I think that we really want to make sure that nurses and doctors and healthcare providers have the proper protective equipment that they need, and that we encourage them to talk to their leadership chains within their organizations. The ones that are made at home, I think, are great for the public if they're concerned and want to have something to protect themselves, but we're not recommending those for healthcare providers at this time.
Another question jumping off that one from WBIR. We've seen reports this morning about the possibility the CDC will instruct more Americans to wear protective masks. Who should wear masks? What kinds are best? And will there be enough?
To be honest, I haven't seen the update from CDC this morning, but in general, healthcare providers that are caring for patients that have or could have COVID-19, first and foremost, are who needs masks. And that's from providers and EMS through the healthcare system, people that are testing patients, all of those folks. We also recommend that people that are caring for people that are ill with COVID-19, where when they have to go to the doctor's office or whatnot, they put those masks on as well if they have to be out. That's where we're sticking with our message at this time. We'll follow up if that changes from the CDC guidance, but I think those things are going to stay in place at this point.
This next question, I'm sorry if I'm not being loud enough with the questions. I'll try to speak up a little bit here. The next question is from WATE. They asked, 11 people have been hospitalized. What treatment are they getting at the hospital that's different from what they can do at home? What is the average length of hospital stay?
So the treatment that they get in the hospital is more high-level supportive care that they can't get at home. So they may need help with their breathing and their supportive care that can go with that. They may need some IV fluids, that kind of thing. So that's things that you can't really always do at home. We still encourage people that need immediate medical attention to seek it, but other than that, to contact their providers. Oh, the average length of stay. Thank you very much. So the average length of stay, I actually don't have that in front of me, and we can look into that. I think in general, the course of illness has been running 5 to 7 days is what we're seeing, but we can look into the average length of stay. I don't have that at this time.
All right. From the Sentinel, how do families know Knox County and Knox County hospitals have the resources to care for a huge influx in hospitalizations like they've had in Middle Tennessee if the numbers of hospital beds and ventilators are available?
I think that it's really important to know that there's a planning process that's been existing for a long time in a partnership with our healthcare partners and public health on how we prepare to respond to these types of events. There's the Knox East Tennessee Healthcare Coalition that public health folks help lead and bring all of our hospitals and partners to the table. And they've been planning for emergency situations that can run the gamut of what that looks like, but surges of patients to the hospitals for years. This has been established in a process that's been in place for a very long time. And with that goes back to what I was talking about earlier, that there's plans in place to be able to conserve PPE as needed. So they have what they need. And then also plans in place that they'll move through together on how they can expand their bed capacity and treatment capacity for patients in need.
The next question is from the Compass. He's following up on his last question. Does Dr. Buchanan have the authority to lift restrictions that are included in Governor Lee's order? For example, can she allow non-essential to reopen?
We would not do that. So the locals could go stricter, but we're not going to lift the orders in our areas that the governor has already put into place.
From WVIR, are runny nose and itchy eyes symptoms of COVID-19? How can someone tell if they have seasonal allergies or the coronavirus without a test?
So the main symptoms for COVID-19 that we continue to talk about and look for are the fever, cough, shortness of breath. And so I think that fever is that key piece. When you're having allergy symptoms, you're not likely to have a fever associated with that. So I think that's really something to be looking at this time. And then also, if there's ever a question, again, we're always encouraging you to consult with your medical provider.
We just got a couple more in. WVR has asked, noticed more people 51 to 60 in the age range are being diagnosed. Is that a trend? What trends are you seeing? Any more details about assisted living facility that had a single case yesterday? And I can repeat those questions because there's a couple there.
Thank you. So I think that it's really early with the low amount of cases that we have to note trends. And so I think that it's a good thing that we're seeing more testing in our community and more people have access to testing, but we don't really have good trend data at this point in time. I think that the next part of the question was related to details on the assisted livings. And so we still, anytime we get an assisted living case, which we did with the one we mentioned yesterday, we are in direct daily contact with those facilities to make sure that anyone that could have been potentially exposed to the case is tested and properly separated from everybody else in the population. That's people who live there and people who work there. This is a process, again, that we do all the time. We're used to working with these facilities. They're used to partnering with us, and it's a process that works well. So we're in daily contact with any of those types of facilities that might get a case. We will continue to do that as needed to make sure things are still going well in their organizations.
Question from Channel 6, following up on hospital resources. How many hospital beds does the county have in total that would be available for extra patients?
That's, again, very difficult because there's different levels of question or levels of response actions that can be taken by our hospital partners to be, and they're meant to be that way. That's a good thing, that they can activate different surge plans in different ways depending on what the needs are at the time.
The Compass has asked, have any cases been identified at any Knox County jail facilities? If so, how many cases have been identified and what measures has KCSO or KCHD taken in response?
We have not identified any cases in the jail population at this time. And we are working closely with Knox County Sheriff's Office on plans for how they will manage any cases that do appear in the jails.
WBR has asked, based on previous question, is the county looking for more ventilators outside the community? What about surge capacity beds like UT dorms, for example?
We are actually talking with our hospital partners on potential alternate care site plans and things of that nature. Those discussions are ongoing. I can't make any firm announcements on what those are right now, but we are talking with them about what that would look like. And they always have plans in place to meet ventilator needs and be able to address those, again, expanding capacity as they come forward. I don't have the details on what each individual hospital will do. Again, I would refer back to them.
Channel 6 has asked, has the county or any hospitals in the county prescribed the, I'm not going to be able to pronounce this, hydrochlorothiazide fluoroxychloroquine to any COVID-19 patients yet? Plan to if patient symptoms are severe?
I can't speak to what the individual medical providers and hospitals or doctors' offices are prescribing at this point in time. I don't have that information.
All right. We don't have any other, are there any other questions? Has anyone sent any questions, Jamie, who couldn't log on?
So we're double checking to make sure we don't have questions if you couldn't hear Kelsey.
Yeah, sorry about that.
Give it another minute before we log off since it's new. Thank you for bearing with us. This, I think, was a really good system that we had in place that keeps everybody safe. So it seemed to work well from my perspective.
People are saying no further questions, so I think we're good.
All right. Thank you, everybody.
Thank you, everybody.